Today's motion is, this House believes that cancer patients should be informed about their diagnosis and prognosis. To open the debate, I'd like to call upon the Prime Minister, Ms. Misato Tanaka.
Thank you, Mr. Speaker, and good afternoon, ladies and gentlemen. I'm a little nervous because in front of me are a lot of people, and next to me is the best speaker, best debater from UK. But anyway, I'll do my best. Okay, so today we discuss whether the cancer patients should be informed about their diagnosis and prognosis or not. And today we have a target to debate on this topic. The target is a person who is middle-aged and terminal cancer patient. So, we assume the situation, for example, the doctor tells the patient that you have lung cancer at the terminal level, and also he said that you have only 3 months remain like this. Okay? So, today the government side strongly believes that as for the notification of cancer, the patient is centered. So the most important thing is that patients have lived as they like in the rest of their life. So today the opposition side should prove that it's better for cancer patients not to be revealed about their diagnosis and prognosis. So today, we government side have two ideas to support our ideas. Okay? The first idea is good for patient, and second point is good for family. I will explain the first idea, and second part now will explain the second point. Okay. The first point, good for patients. Let me confirm. Firstly, let me confirm two main characters in today's debate. It is doctor and patient. So firstly, about doctor. Doctors have a special knowledge about diseases and, of course, the prognosis and diagnosis and prognosis of patients. And about patients. Patients don't know anything special about diseases, and they are only waiting to be informed by doctors about information. And they have the right to know, but they cannot use it until doctor tells it. So the patients cannot distinguish if the doctor has a secret to them, if doctor has something he didn't tell or not. And now, we cannot say that the relationship between doctor and patient is good, because there are many troubles, many accidents, medical accidents, many illegal orders happened in the hospital. For example, the patient's family gives a lot of money to the doctors before the operation as a bribe. And it is a bad thing, but doctors get it and then do the operation. It is very illegal, and this is not good order, but it happened. And also, there are many, we hear the doctors pay operation, and it causes death to the patients like this. So, most of patients cannot believe the doctor, cannot see the doctor as a beautiful one. And we cannot trust doctor tells us all the things he can tell. Because they cannot trust doctors, they cannot obey doctor. And then the treatment will not work well, and their diseases won't be cured. So these things tell us that good treatment needs good relationship between doctor and patient. And to build a good relationship, information is needed. Okay? And then, so what kind of information patients really want to hear? It is diagnosis and prognosis. Because by knowing diagnosis and prognosis, what kind of diseases I have, what kind of treatment I need, patients can realize such a question. And there is no secret, so the good relationship will appear. And to know that, the right to know probably exists to the patient. These things produce positive care, that is to say, alternative ways of treatment will be given to the patients. And this is the freedom of choice. So before looking at the kind of this choice they have, let me think about today's problem, cancer. So what is a cancer? Cancer's different point from other diseases like heart attack or infection is that the cancer remains people some days, some months, some years. It is a different point from other diseases. And then, by having the information, the patient can choose the two ways, the alternative options. The first one is to select the life support system to using anti-cancer drug and prolong their life. And second option is not using this system and only to use morphine and to live as they like in like outside. And without information, doctor indicates you only a way, and then what you can do is only to obey the doctor. So this is a good point to inform about the diagnosis and prognosis, which is you can choose to choose the option. And for example, if please imagine that you are a 30 years old father with small children, and you don't have much days to live, and then you might think that what is the best way to live with children in the rest of life, and you can choose how you live as you like. The first option is, even if the treatment is very painful and you have to be in the bed all the day and every day, you can choose. You can see the children as long as possible. And second option is that, for example, if you want to go outside with children and to make a good memory with children to make them happy, you can go to Disneyland or somewhere else and with children, and children can also make a fun memory with father like this. So for him, choosing a way to spend with children makes his life better life remained as a not regrettable one. So let me summarize my speech. So we have today the government sides think that today's motion is good for patients because these three things will exist. The three things is the right to know, good relationship with the doctor, and the freedom of choice. Thank you very much.
Okay, I would like to thank Masato and call upon Ben Jasper to open the case for the opposition.
Well, firstly, thank you all very much for coming. It really is a great honour to speak at Kyushu University, and thank you for giving up your time to come and hopefully hear what will prove to be a good debate. Our case today is that telling cancer patients both their diagnosis and their prognosis really harms them. We think in most cases it shortens their period of life, and it removes all hope from those last few months that they have to live. And we agree that the last few months that they should have should be as enjoyable as possible. We beg to oppose this motion.
Okay, I'd like to thank Mr. Benjamin Jasper very much, and to continue the case for the government team, call upon Mr. Ryutaro Okishi.
Good afternoon, ladies and gentlemen. there is a main purpose. If there is something mistakes, worry back, please. Okay. First of all, when you think about patient family, what is patient family? For patients, that kind of people is very important person. They live with they live with parents or brothers or sisters for their whole lives. So if doctors don't inform, the family have burden for this. So this is very unhappy situation for patients. And if doctors inform the situation, the family have less burden. So we believe that we should inform for patients. Okay. Second of all, let me refute back to the opposition side argument. About first argument, this is that prognosis is not exact. Yes, this is true. The exact that is not exact. But we believe that what is important for this debate is to know they will die or not. And if we know I will die, we can choose what they want to do before die. But on the other hand, if we don't know about it, we can't select. So because of this, this point is not done. And second point, fears. Fears. They can feel fear, but this is not true. Yeah, sometimes they can fear, but finally they can calm down. There is a research. Do you know the Kübler-Ross? There is a famous mental doctor, and this is that the patient informed cancers. This through the 5 steps, and finally they feel calm down. Moreover, so because of this reason that they have fear, but they still patients have hope for this. And third, let me reconsider our argument about give too much information makes patients confused. But yes, something to some extent this is true. But patients can do effort. If there is too much information, they can use internet or like that and get information, and finally they can know much about their bodies. Okay.
So, but if they go to the internet, they're likely to believe that less than their doctor. If you go to your doctor and he says you will die this time, aren't they likely to believe that more and likely to be more afraid that they'll die then?
Yeah. All patients don't always believe internet. They think that they judge it from internet or and doctors. So so we believe that this is not true, and so our point is still stand. And okay, let me explain our argument. Our second argument is burden of family. Let me think about burden of family from 2 aspects. First aspect is that family can't say what they want to say. Okay, please imagine, ladies and gentlemen, if your family become cancer, and you have to conceive, you want to or you have to have something they want to say, just simply thank you for like that. But you have to conceive to recognize to not to recognize by patient they were cancers. you can say such as things. This is very big burden for families. On the other hand, if we can doctor informed about the patients, the family can speak enough, talk enough with patients. So this is less burdens, ladies and gentlemen. And second aspect is that family worry whether patient has regret or not. If we consider, if doctor not informed, this means that the family select a patient for limited right. They can patient know about nothing. This is very and this is very burden for families. They worry about this. They may have things that they want to do. Before that, they want to go climbing mountain or go to Disneyland with with his children, like that. Because of this, on the other hand, we can say that on the other hand, if doctor informed about their cancers, family and patient can talk with each other, and family can confirm patient really what they want to do. So family are less burden for this, have less burden. So from two aspects, family have less burden. Let me summarize what I say in my speech. First, as family is an important person for patients, and second, I said that second opposition side's point is not stand, and for our argument, we said that about family's burden is a burden, and this is very bad for patients. Because of these reasons, we strongly believe that we should inform about their cancers. Thank you for listening.
Thank you, Ryan Tyron, very much for that speech, and call upon Melanie Bunce to continue the opposition case.
Ladies and gentlemen, thank you very much for coming here today to watch this debate, and thank you to the other team for their speeches so far. It's a real honour to be here at Kyushu University and speaking to so many enthusiastic people. So what I'd like to spend my 7 minutes doing today is responding to some of their arguments, firstly, and then going on to make two main points. The first one I want to talk about is how individuals react when they get bad news, and the negative changes they make in their life in those times that we want to avoid. And the other thing I want to talk about, the second thing, is the medical industry and how the policy the government is proposing can actually undermine the medical industry. That could be bad because it could be harmful to the individual and their behaviour, but it could also be harmful to the medical industry as a whole. Thank you very much for your time.
I'd like to thank Melanie for her speech. And now, just like I said earlier, we reverse the order. And so next up will be Mr. Fred Cowell to close out the opposition team's argument.
Thank you, ladies and gentlemen. Well, I'm very pleased to be here, and my job in this debate is to summarise and conclude the debate for the opposition side. Something left to live for, and not feel that they only have so many weeks, so many hours, so many days, and and so many minutes left of precious life. For these reasons, we oppose this.
Okay, I would like to thank Fred Cow very much and the entire opposition team. And now to close out the government team and the debate as a whole, I'd like to call upon Ms. Razumi Nagata.
mutual understanding rather than to live longer or healthier or richer or something. Such kind of things only a result of their selection. So the most important thing is selection. Okay, let me repeat what they are correct in the correct argument about drastic change for their lifestyle. Here, it's natural, but big turning point in the life always change their lives, their lifestyle, and their values. And notification may cause too drastic change, however, ladies and gentlemen. Panic situation will not last forever. It will, because they die, patient will accept their fate, and family will contribute to this because if informing is done, families and patients have common sense, share their same difficulty, and so they can endure together. They can struggle together. And about their fourth argument about medical industry. However, if there are some misjudgment, we don't have any other choice rather than any other than doctors. So think about the weather forecast, ladies and gentlemen. It's sometimes wrong. However, we will see weather report today and the previous day. And a little more. If misjudgment occurs, it asks for improvement, and medical industry will be better one. So this one can stand. Okay. To summarize this debate, let me give you one big criteria about for patients to live the rest of their lifetime. Which side is better for their patient? And I will explain this criteria from two aspects. First aspect is about confronting, ladies and gentlemen. What is cancer? What is diseases? It's a kind of disease. They are challenges. And even if we don't notice that they are cancer, there will be large burden too. And their physical bad situation and unnatural attitude of the certain people and distrust to them and fear loneliness, such kind of stuff. And to conceal that completely it is impossible. They will be aware day by day and gradually. So in either way, patients will face the difficulty. And please compare the situation of government and opposition. And if you are informed, patients can confront their true faith. They can struggle their true their faith. And as it more, patients can have contact with other people in the same situation. And they can share their story to die. And they can make better preparation for their die. So if you are informed, you are a primary cancer patient, and you may get resigned, get panic, and change lifestyle. Cancer patient will accept such kind of disease. That's definitely. And second aspect is about control. It's very natural for us to want to control our lives. That's it. So we want to decide how to deal with our rest of time. I believe that most of you should have something to be done before you die. So notification will enable this selection. They are argue is that patients should be informed their prognosis and diagnosis of cancer.
Okay, what we're going to do now is we're going to get all of you to decide who you think won that debate. So now it's up to you, though, to decide who won the debate. So what we'll do is, by a show of hands, those who believe that the government team have won this debate and that we should tell cancer patients what their diagnosis and prognosis is. And I remind you, you're not voting on what you actually believe in a debate. You're voting on which team you think argued best, which team persuaded you more, not necessarily what you believe. So those who believe that the government team argued best and that we should tell people what their cancer patients, what their prognosis and diagnosis is, please raise your hands and say aye.
Aye.
Now, those who believe that the opposition argued best and that we should not tell cancer patients what their prognosis and diagnosis is, raise your hands and say nay. Those who abstained from voting, I think that's most of you. So I think we actually had 5 votes each in terms of those who actually voted. So I would like to announce this debate as a tie.